All right, Barbara, can you tell me about why you're here today?
I'm here. I probably have walked in every HIV and AIDS walk since the very beginning. I've worked at Whitman-Walker Health for 40 years, first as a volunteer, founded the first lesbian health center in 1979 as part of the original Whitman-Walker. I became a physician assistant in the late 70s, and in the mid-80s, when the AIDS epidemic, or the early 80s, when the AIDS epidemic hit, I got very interested in that. So my second job as a PA was to go to GW to work in the AIDS clinical trials unit. So I've been involved in HIV and AIDS since the very beginning of the epidemic and helped people get on the new medications. So I did that for 10 years, and then but I volunteered at Whitman-Walker all those years. Went back to Whitman-Walker as a full-time, or went to Whitman-Walker as a full-time employee in 2000, and have been seeing patients there now for 19 years. So long affiliation with Whitman-Walker, very strong commitment to the HIV and AIDS epidemic, and that's why I'm here today. So I'm on staff at Whitman-Walker.
Right. And how, if you don't mind me asking, what was your first experience learning about safe sex?
Safe sex was when I was doing a lot of, actually, well, there was two different things. Safe sex with men and also safe sex between women. Because I worked with Emily Zern also at Lesbian Services Program, and we had a whole safe sex campaign that during those years, in the early 90s, when the Lesbian Services Program started. And this was, of course, after our first lesbian health center back in the 70s. So I guess it was more in the 90s among women that we talked about it. In the 80s, more so among men who are having sex with men.
What does safe sex mean to you personally?
Well, it means protecting yourself against either giving or receiving any either sexually transmitted infection, or for women, it could be something like HPV or bacterial vaginosis, which are actually commonly transmitted against female-bodied partners with female-bodied partners. Most of the other things usually need a penis involved. But women need to know how to protect themselves against those things as well.
Did your understanding of safe sex evolve throughout your time in activism and working with Whitman-Walker?
Did it what? Develop?
Evolve, yeah.
Did it evolve? Yes, it did evolve over time. Because we certainly had, we like to ask lots of questions about people's sexual practices, because that's an important thing to take a good sexual history. So I think it's evolved as we understood what people were doing to have sex and what kinds of sex they were having, and what kinds of toys or other things they were using. So it's really important to understand that. And if you're a practitioner particularly, you need to know that about your patients. So you need to be able to know how to counsel them. So probably learning what people do helped us evolve how to protect ourselves. And who is at risk for what.
Can you tell me about when you first learned about AIDS?
Yes,
I'm sorry, can you tell me about when you first learned about AIDS?
Yes. I was actually working at the Lesbian Health Center when we were volunteering, when Whitman-Walker was on 18th Street, 18th and Belmont, and we were downstairs, and there was a bulletin board, and there were clippings on the bulletin board talking about these strange incidences of cancer and pneumonia in San Francisco and New York and LA. And they didn't know what, this was like 1981. So 1981, I would say, is when I first got an awareness that there was something starting to happen, mostly in the gay community, gay men, or men who have sex with men at that time. And so from there, Whitman-Walker was a small little sleepy clinic that was actually serving it was a gay and lesbian clinic at the time. We hadn't expanded to transgender or bisexual in those years. In the late 70s, it was kind of like gay and lesbian. So, I lost my train of thought. What was the question again?
About your first time learning about AIDS.
Yeah, so when we learned about it, and then we knew that Whitman-Walker as a whole sort of rose to the occasion to become a big AIDS service organization. And as lesbians, we were kind of separate in a lot of ways. We didn't work very closely necessarily with gay men. Our lesbian health center was sort of just by ourselves within the clinic. But as the epidemic progressed, into the 80s and people started dying, women who, were very strong nurturers, and I think we got very involved in wanting to help, as I would say, our gay brothers during those years, and to try to participate in aiding with the epidemic. At the same time, we were always also very conscious of women who were getting HIV, and we wanted to also support that and get that word out there, that women were also getting infected. But women were getting infected from men. They weren't getting infected from other women, either from men or they were getting infected from IV drug use. But I really don't know of any woman-to-woman transmission of HIV that I've ever seen.
Can you tell me a little bit about how you got the word out?
Can't hear you.
Sorry, can you tell me a little bit about how you got involved, how you got the word out?
How we got the word out? I think we just did, there's just different campaigns. There was a safe sex campaign. We went into bars. We gave out safe sex kits. So we did that. I think that was the main thing that we did sort of on a very sort of grassroots level. Certainly people participated in all the actions that were going on at the FDA with ACT UP and trying to get the medications fast-tracked for HIV. So I was doing clinical trials for things that were being put in there, but we were also trying to get more things fast-tracked. We had a buyers club in town called the Carl Vogel Center, and they were trying to get medications from overseas or other places they thought may be of use. In terms of otherwise getting the word out, I think Whitman-Walker was just doing campaigns about HIV. I mean, we're talking about a couple different things here, safe sex and HIV, but I didn't really answer that exactly, but.
Can you tell me a little bit about the first Whitman-Walker 5K? Because you said you were here.
I wasn't in the 5K. I was just a walk. So I don't know about the 5K. Yeah. I know the 5K happens. What year was the walk? I can't remember what year the first walk was, now I think about it. It was actually, I'll take that back. Was it a 5K walk? I think it was actually. The very first walk was in Rock Creek Park, and I think it was a 5K walk. Now it's a 5K run, and we do a regular walk. But the 5K walk was, gosh, when was that? 90s? I don't know that. I have to find that out. I probably have a T-shirt from every year, but I forget what year it was. But you're right, the 5K walk. So yeah, we didn't used to do it down here. We had a nice stroll in Rock Creek Park.
How do you think that the first one compares to today?
Well, there's a whole lot more organizations that are supporting it. I think that in DC, I think people are really interested in wanting to end the epidemic. I think over the last 5 years, we felt like we changed the name to the Walk to End HIV because we've made so much progress in keeping people from getting AIDS, or when people had, their immune systems are so suppressed that they have AIDS. I think we've made a lot of progress in reversing that. So now, of course, we want to end it completely if we can. And I think there's two things that are on the right track for that, besides vaccines and trials, and is prevention and treatment as prevention. Because there's the whole campaign of U = U, which is if you're undetectable virus, you can't transmit. So if you're on medicine and you get the virus to undetectable levels, you're not transmitting. So it's kind of like treatment as prevention, and now we have medications also as prevention. We need to get the word out further into the communities that are the most vulnerable, so into the communities that don't have as much access or understanding of what it means to prevent it or get treated. And into minority communities, we need to get that word out. And I think we're trying. Whitman-Walker's expanding even further in the southeast to try to get people in that part of town. We've already had a clinic there for many years, the Max Robinson Center, but we're even going to be expanding that and make it bigger and better. Is that it?
One more question, if you don't mind. What would you want the next generation to know about safe sex?
Well, I think I would like people to really get to take charge of their health, take charge of their bodies, know what is good for you, diet, exercise, and also preventing getting sick and getting infections. And safe sex is part of that. So I think it's basically a self-empowerment. To empower yourself, feel good about yourself, take charge of your health, and that includes safe sex as well.